Hi, good morning, everybody. My name is Newsha Ghaeli, and I'm president and co-founder at Biobot. Biobot is a wastewater epidemiology company, and we're building a human health intelligence platform for both biosecurity and healthcare applications. Some of you may have heard of wastewater epidemiology or wastewater monitoring or surveillance, as it gained a lot of popularity during the COVID pandemic. And it's based on a very simple idea. There's a ton of information about our health in our urine and stool, and every day we're flushing this information down the toilet, where it's aggregating with waste from hundreds of thousands of other people. At Biobot, we've developed expertise in collecting and analyzing infectious disease viruses and bacteria and chemical markers in sewage. And this is an incredibly efficient source of biosecurity and healthcare intelligence. Our vision at Biobot is expansive. We build products that can prevent the next pandemic, detect waves in illicit drug use and manufacturing, improve national security through the identification of man-made threats, identify asymptomatic and invisible patient populations, and ensure food security and the stability of our food supply chain. Biobot was founded in 2017 by myself and Mariana Matus, and today I'm going to briefly tell you about our story over the last several years working with government. Mariana and I met as research collaborators at MIT before being accepted into YC. Given our very diverse backgrounds, we always knew that our work could bring value across many sectors in healthcare, but we intentionally chose to sell to government first because we needed our technology to be integrated into cities, and we needed government's buy-in in order to do this. We also believed that we could help solve some pretty big problems that were faced by our elected officials and government agencies. And so we built our first application in response to the country's biggest public health crisis at the time, the opioid epidemic. It is estimated that opioid overdose data, which is used to inform government resource allocation and response, represents less than 1% of people who suffer from substance use disorder. Less than 1%. So we're spending billions of dollars of federal aid, and we don't even understand the full scope of the problem. Our data from wastewater, by contrast, was representative of everybody in a community, people who were alive and consuming drugs today. In the first couple years since founding, we scaled our technology to a handful of cities across the country. For example, using our data, a town in North Carolina decreased overdoses by 40% from 2018 to 2019. Now, despite this very clear value proposition, it was very hard selling to government in those early days. We were bringing to market a cutting-edge technology in a slow-to-adopt industry, one where it was typical for new technologies to be proven over years before adoption. So now fast forward to 2020, and the world was consumed by COVID-19. When we learned that the virus that caused COVID was found in stool, we decided to deploy our technology and the use of proceeds from a fresh round of funding to respond. By March 2020, our team of just 5 people had launched the ability to detect COVID in sewage, and our data quickly became one of the most accurate representations of the scope of the pandemic. However, early on, public health agencies were very focused on established technologies, things we knew, like vaccines and clinical testing. And in fact, early in 2020, top public health experts told us that this technology was not yet ready for prime time, and put cautionary notices out to local communities engaged with wastewater epi. But we believe this data was necessary, so we kept going. And in a matter of weeks, we had scaled to work with hundreds of communities and government agencies across the country. By 2021, we were working in all 50 states, and our team had grown 20-fold. We were seeing contracts come our way from local, county, and state governments. Finally, in 2021, the CDC and HHS got behind the value of wastewater data, and our first federal contract materialized. Soon we had others, like with the US Army and the NIH. We had created a market. Press and the general public were very intrigued by wastewater epi, and so we leaned in. We briefed the White House, we testified to Congress on why we need to invest in a national wastewater surveillance program, and all the while we were getting pinged by the private sector to build applications for them. But we just didn't have the bandwidth. We wanted to really focus on responding to COVID-19 and working with the CDC to expand to new targets like Mpox. But when the time came to renew our contract with the CDC into a coveted 5-year contract vehicle, we lost. We lost the renewal of the contract that we helped establish to Ghaeli, an alphabet company who undercut our price, which was public on USA Spending, SAM.gov, by over 60%. The pricing felt designed to push us and everybody else out. Had we priced anywhere near there, we'd be in negative margins. So this was 18 months ago, and the last 18 months have been hard, given the loss in revenue, but they've also been unexpectedly successful. We went back to our original founding roadmap, which had the vision to build wastewater data products for the entire healthcare industry, both private and public. We've had the space to explore and execute on new products, and we've had a surprising level of success. We've validated that wastewater epidemiology is a dual-use technology with both commercial and government applications. Within government, we're seeing increased demand for wastewater data, biosecurity applications with defense, data for high-risk substances like fentanyl and meth, and viruses of current interest like measles. So I will wrap by saying that our journey has taught us that when you create a valuable new market, others will follow, and big tech has tools and resources that startups don't. But we've also learned firsthand that focus and innovation pays off. It paid off in 2020, and it's paying off again now. Thank you.